Well, from one problem to another, stress. It is so hard to beat. Job-related, personal problems really is just a fact of life for all of us. And so we're so glad to have Dr. Ofer Shustik in from Coordinated Health. And he's bringing a couple ways to try and manage it all, because you can't avoid it. Stress is just a part of life, isn't it?
Correct, it is.
Got it. So, you know, the concern I know that you have in your field is that oftentimes stress can morph into something much serious, diseases in fact.
Correct. I mean, since 1992, we are taking advantage of April as the Stress Awareness Month to make people aware of how much the effect stress has on body and mind. And we know that the body responds with a sympathetic way of fight or flight. When you are exposed to stress, your body is producing hormone stress that are cortisol and adrenaline, and they affect your body in different ways. It's affecting different systems in your body. For example, if we look at the lung, it's creating much more the breathing is getting faster, and if you have COPD, asthma, emphysema, it's making it much harder to breathe.
Wow. So it's not just necessarily a headache or insomnia, but truly troubling medical issues.
You're right. Most of the symptoms will be, the presenting symptoms can be headache, can be insomnia, but it's affecting your heart. We call it now the silent killer.
Yes.
It can cause your heart rate to increase, it can cause your blood pressure to increase, therefore exposing you to have much more risk to develop stroke and heart attack.
It just manifests itself in so many ways. Concrete tips to reduce the stress. I know that some of it is basic knowledge, but still it's hard to get sometimes.
You're right. I think that the most important thing that I see in my practice is that patients need to identify the stressor and acknowledge that they have them, because we're so used to live in a stressful situation. And by doing this, obviously, if you can avoid the stressor or reduce the stressor will be good, but most of the time we don't have any control of the stressor.
Exercise helps?
Exercise definitely helps. Exercise, and we know it's increasing the endorphins in your body and will help you to relax, helping you to feel better. But meditation, yoga, taking some me time.
What about what you eat?
Absolutely important. You know, we know that if you can try to check, you know, try to get like more vegetables, more fruits, avoid the carbohydrate, avoid the sugar, will help.
I asked you about wine earlier.
Wine is not the best solution.
You think it helps, but really, in the long run,
doesn't.
not necessarily.
Correct.
And then regular checkups, that's key right there.
It is a key, because we know that 80 to 90% of office visits to primary care are stress related. The U.S. Preventative Task Force is recommending to screen for depression, anxiety as they related to stress. And therefore, seeing a physician that can help you, like in my practice, I'm screening for other disease that can present this way, and then we can offer help, also medication, even though this is not my first line of choice.
Do you take I've got to leave it with this, do you take your own advice? You're good at giving it, can you?
Yes, it's much easier to give them, but I am trying. I'm exercise every day, I'm trying to take advantage of the wonderful weather that we have here. And I like to enjoy biking, enjoy walking, and I also rely on my family for stress relief and for distress.
You're in a high stress profession. So
I am, and it's becoming a major issue for physicians and burnout.
Absolutely. Thank you so much for taking time to come in and speak with us about it.